I just wanted to welcome you all to the webinar where we're going to discuss the RACGP's Standards for General Practices 5th edition. As I said, my name's Angela. I'm a Senior Project Officer in the Standards Unit here at the college, and my colleague Siobhan is here to answer your questions throughout the webinar, and will provide links through the chat box there. So I just wanted to start with an acknowledgement to country. We would like to acknowledge the traditional owners of the land on which this event is being broadcast. Thank you for providing access to this part of your country. As you may be new to webinars, we thought we would take a few moments to help you feel comfortable with the learning platform and your options to communicate with us. So, where is my control panel? Throughout the webinar, we will refer to your control panel. If you're using a computer to participate and you're unable to see a pale blue and grey screen like the one pictured on this slide here, look for the red arrow in a small box on the top right of your screen and click it, and the control panel should open. So the control panel provides you with tools to select if you're using mic, speakers or phone to listen in, and also a place to ask questions. So we've got the question box there and also the chat box. During the webinar, all participants have been set to mute from our end, so this just ensures that any background noise is eliminated. If you have any questions, like I said, through the webinar, please send them through the question box on the blue-grey panel. And we've also got time to address any other questions you might have at the end of the presentation. So I understand that a number of attendees are joining us from in and around the Murrumbidgee. I hope I've got that right. We're interested to know where our attendees are tuning in from. So let's practice using the question bar by just typing in the town or suburb where you are located now. If you can just pop it in there. So Siobhan and I are sitting in the RACGP National office in East Melbourne here. And we've got someone tuning in from Wagga Wagga, from Young, from Tocumwal, and the Wagga Wagga Murrumbidgee Primary Health Network. So that's great. So just launching into the presentation, in order to provide some context, I wanted to describe the standards development process. The RACGP Expert Committee, Standards for General Practices, or simply the Standards Committee, is made up predominantly of practicing GPs from rural and urban practices. The committee also has a practice manager and practice nurse representatives, as we know that often practice managers and nurses take the lead in preparing the practice for an upcoming on-site survey visit. We also have a consumer representative to ensure that we consider patient perspectives during the standards development process. We've also got someone tuned in from Deniliquin. Just wanted to make sure you got a mention there. So the 4th edition of the standards were released in October 2010, and a decision was made that in order to reflect contemporary general practice, they needed to be updated. The RACGP commenced the update of the standards in February 2015, and a rigorous and comprehensive process was adopted, which included an evaluation of the 4th edition standards. We've received considerable anecdotal feedback at the college regarding the standards, but this was an opportunity to seek feedback on specific issues. So to do this, we held a series of workshops throughout the country. We contacted local PHNs to help organise these and recruit practices, and there was a mixed uptake in the number of attendees. We undertook an assessment of available evidence throughout a literature review. We looked at comparable national and international standards like those in the UK, New Zealand, Canada, as well as ISQA's requirements. This information, the literature review and comparable standards analysis, was presented to the Standards Committee for consideration. The committee then provided advice to guide the development of a first draft of the standards. The draft standards then went out for consultation, and that feedback was presented to the Standards Committee and informed the development of a second draft. So the second draft standards were then piloted on a small scale to test the process and methodology, and then this process was refined for the large-scale pilot, which included a total of 66 practices. Finally, the standards also underwent a targeted review to resolve any other outstanding issues that stakeholders had identified during the small and large-scale pilot. The feedback from successive consultations and pilots were presented to the Standards Committee and used to inform the development of each draft. It was a very time-consuming and robust process. The standards were finalised and an embargoed copy was shared with the accreditation agencies to help them prepare for the standards launch at GP17 last year. In addition, the standards underwent the ISQA, or International Society for Quality in Healthcare accreditation. So that means that the RACGP standards for general practices have been independently assessed as meeting the highest quality and safety standards. So there's a number of changes between the 4th and 5th edition standards, which I will now take you through. One of the changes is that the standards have been restructured from 5 sections in the 4th edition into 3 modules in the 5th edition. And you can see that in the first 2 pie charts there, diagrams. The 3 modules cover the same content that was in the 4th edition standards, but it's just been reordered. So the standards 5th edition consists of the 3 modules: the core module, quality improvement module, and general practice module. The core and QI modules are generic to a range of primary and community healthcare settings, where the general practice module is unique to a general practice setting. The modular structure allows the RACGP to update the modules separately and adapt the standards for other healthcare settings such as correctional services and immigration detention centres. So the core module is made up of 8 standards and is relevant for all healthcare settings, like I mentioned, and a few of them we've got information management, content of patient health records, rights and needs of patients in the list there. The quality improvement module is also relevant for all healthcare settings and is made up of 3 standards. So the quality improvement module includes patient feedback. The clinical indicators relates to recording of allergies and health summaries, and clinical risk management includes safe and quality use of medicine, adverse events, and managing and responding to near misses. Then onto the GP module, which is specific for general practices. So in the list there, the medical practice standard relates to ensuring practice facilities are fit for purpose, visibly clean, and the practice's equipment. So between the 4th and 5th editions, there's been some changes to the numbering of the criterion. So in the 5th edition, each module is denoted by C for core, QI for quality improvement, and GP for general practice. Then the relevant standard, followed by the criterion, and then the indicator. So it's got an example there. So core module is C, standard 1, communication with patients, and the criterion 1, practice information, makes it C1.1. And then the first indicator there is A, and the indicator is what the practices are assessed against. Here's an example of a criterion in the 5th edition standards. You'll note that there's a lot of similarity to the 4th edition. For example, the indicators, like the indicator format, where being flagged with the triangle denotes a mandatory requirement. And there have been a few changes to the way the explanatory notes have been set out. So now we've got why this is important, which explains how the indicators and criterion support quality and safety in practice. Meeting this criterion, which gives the reader more context, and then meeting each indicator, which describes what a practice must do as a minimum in order to meet the standards. And it also goes on to describe what a practice could do as well. So the previous editions of the standards dictated what systems and processes practices should follow to demonstrate compliance with the standards. The 4th edition standards focused on processes. The 5th edition standards is now outcomes focused. So practices can choose how they demonstrate that they meet the intent of each indicator, and provided that the practice team can explain this and provide evidence to the surveyor's satisfaction, the practice will be assessed as having met the indicator. This approach gives practices greater scope to set up systems and processes that reflect the working arrangements in their practice and will be easier to maintain after their accreditation assessment. It gives practices a choice to choose meaningful ways to demonstrate that they meet the indicators, and consequently it is intended that practices will have a greater sense of control and ownership, therefore more likely to be adhered to and maintained outside of the accreditation assessment process. So here's some examples of outcome-focused indicators. So under the 4th edition standards, an example here, practices were required to ensure all members of our practice team have position descriptions and can describe their role in practice, whereas under the 5th edition standards, that indicator has changed to all members understand their role, and there may be a number of ways a practice team could demonstrate this other than a position description. Similarly, in the next example, our practice has a process for seeking and responding to feedback from patients and other people, and our practice team can describe this process. This emphasis here is on the process, whereas the overall intent is about collecting and responding to feedback, hence the way it's now described in the 5th edition standards. So the indicators have also been revised to be patient-focused where appropriate. There's been a shift in language to focus on what the patient receives. For example, in the 4th edition, practices needed to be aware of the arrangements in place for their patients to access after-hours care. This has been reframed in active language to our patients can access after-hours care. The indicators under the 5th edition standards have also been simplified. So here's an example from the 4th edition on the left, which lists content to be included in the referral letter where appropriate. So in contrast, the 5th edition standards have simplified this by removing the list from the indicator, and that content has now been described in the explanatory notes instead. And this change has been made in response to feedback from stakeholders. Why this indicator is important was not immediately obvious in the 4th edition. Practices were trying to meet indicators just because they're in the standards without understanding why or how they improved quality and safety. Feedback was received about the large blocks of text in the 4th edition, with some inclusions that did not refer to any indicators. So we've tried to make the explanatory notes more useful and move anything not related to the indicators into the accompanying resource guide. And it's important to read the whole criterion to understand the requirements. The explanatory notes provide the context around each indicator. So in the 5th edition, it covers all the areas that are in the 4th edition, but there's been some new indicators covered in some new indicators cover areas in the 4th edition that were mentioned in the explanatory notes or in the criterion that previously had no indicators. And some new indicators cover gaps identified during the consultation phases or by ISQA, who accredits our standards. So it's a bit of a list, but I will go through all the new indicators in the 5th edition. And when you look on the little control panel there, Siobhan's put up some handouts that you can download as PDFs. And one of them is the FAQs for the standards 5th edition. And on the back of that, the second page of that FAQ sheet, it actually lists all the new indicators. So you don't have to scribble them all down when I go through them now. So in the core module, there are 11 new indicators, which includes 1.4c, our patients can access resources that are culturally appropriate, translated and or in plain English. Core 1.5a, our patients are informed about out-of-pocket costs for healthcare and the healthcare they receive at our practice. And Core 1.5b, our patients are informed that there are potential out-of-pocket costs for referred services. So it's important to note that this does not mean practices need to know the out-of-pocket costs for every healthcare provider they refer to, just that they need to advise patients that there is the potential for these to be incurred. And the college actually developed a fact sheet on this topic, which is included in the handouts there for you to download. So the next new indicator is Core 2.1e, our clinical team considers ethical dilemmas. Core 3.1a, our practice plans and sets goals aimed at improving our services. Core 3.1b, our practice evaluates its progress towards achieving its goals. And with all of these, you can see on the next column, it explains why these new indicators have been included in the 5th edition. And then Core 3.1c, our practice has a business risk management system that identifies, monitors and mitigates risks in the practice. Core 4.1a, our practice receives appropriately tailored information about health promotion, illness prevention and preventative care. Core 5.2a, our clinical team can exercise autonomy to the full scope of their practice, skills and knowledge when making decisions that affect clinical care. Core 6.4f, our practice has a policy about the use of email. And Core 6.4g, our practice has a policy about the use of social media. And actually, the college has developed templates for both, a policy template for the use of email in practice and also a policy template about the use of social media. And Siobhan's just sending out links to those, and those templates were set up so that your practice can adapt the information in it to your individual practice. So they should be there in Word doc form for you to download and fix up. And some new indicators in the quality improvement module. We've got QI 1.1c. Our practice seeks feedback from the team about our quality improvement systems and the performance of these systems. QI 1.3b, our practice uses relevant patient and practice data to improve clinical practice, for example, chronic disease management or preventative health. And QI 3.2a, our practice follows an open disclosure process based on the Australian Open Disclosure Framework. And that was identified as a gap in the 4th edition standards during the initial consultation phase. And onto the third module, the general practice module. 2.2d, our practice initiates and manages patient reminders. And GP 2.2e, high risk, seriously abnormal and life-threatening results identified outside normal opening hours are managed by our practice. GP 3.1c, our clinical team is trained to use the practice's equipment. that they need to properly perform their role. And GP 3.1D, our clinical team is aware of the potential risks associated with equipment use. GP 4.1F, our practice records the sterilisation load number from the sterile barrier system in the patient's medical record when sterile items have been used and records the patient's name against those load numbers in a sterilisation log or list. And finally, the last new indicator there is GP 5.2E. Our practice has a defibrillator. So a number of stakeholders suggested that defibrillators be included in the new edition of the standards during the initial consultation phase. However, this indicator is not mandatory. So just moving on to patient feedback. We've got the patient feedback guide there as a download PDF in the handouts for you. So patient feedback, seeking patient feedback is an opportunity to meaningfully engage with your patients, and there are opportunities for the practice to implement quality improvements based on that feedback. So the focus should be on that outcome, quality improvement, rather than the process of collecting the feedback. Under the 5th edition standards, patient feedback is more flexible. So practices can now develop their own tool or method of collecting patient feedback, and provided it meets the requirements set out in the patient feedback guide, it will be approved by the RACGP. Practices can still use the RACGP toolkit and commercial tools. So the patient feedback guide, as mentioned, it's there to download in the handout. The revised patient feedback guide provides support to practices, and practices have flexibility to create their own method of collecting patient feedback, which could include an app, critical friends group, etc. The toolkit for developing practice-specific questionnaires has been developed as a supplement to the patient feedback guide. So this toolkit provides information and resources to assist practices in developing their own patient experience questionnaire for the purposes of meeting the standards 4th and 5th editions. And it provides a framework and a range of templates to assist the development of a practice-specific questionnaire. And please note that if practices choose to use the toolkit as described, they do not need to submit the tool and associated documents to the RACGP. However, if the practice wants to make changes to the wording of questions or introduce new questions, the tool has essentially been revised and needs to be reviewed and approved by the RACGP, and the fee for this is $150. But the RACGP will work with the practice to ensure that practices' tools meet the requirements set out in the guide. And then, of course, we've got the resource guide, as mentioned earlier. And the resource guide has been developed to as a supplementary resource to accompany the 5th edition standards. It includes additional resources and links to support practices in meeting the criterion and indicators, and it will be updated regularly with any new resources that become available. The resource guide is there in the handouts. Oh, so it's been sent through the chat to download that. So you can download it directly from the college website. So currently practices can choose whether to undergo accreditation against the 4th or the 5th edition standards. But from the 1st of November this year, all practices will need to gain accreditation against the 5th edition standards. So you can visit the college website for more information, or please feel free to email us here at Standards any questions or for further information. And it's just standards@racgp.org.au.